Let's talk about the three most common reasons you might feel like your legs give out when you're walking. It could be after a prolonged walk, or it could be even once you get out of a chair and you take those first couple steps. If you feel your knees want to buckle or your legs want to give out, these three reasons could be a contributing factor to why you're having that problem. But first, if you don't know me, my name's Tony Maritato. I'm a licensed physical therapist, and I specialize in treating adults suffering from orthopedic conditions. So the first reason I want to discuss is commonly known as spinal stenosis. Spinal stenosis is a condition that affects the lumbar spine, which is your low back. And essentially what happens is degenerative changes, you can refer to it as arthritis, affects the size of the canals through which your nerve roots have to travel. So your lumbar spine, you have lumbar nerve roots that come out of the lumbar spine. They go through these canals to go out into the legs. And as those canals get smaller because of arthritic changes, they start to compress the nerves. I often describe this as if you imagine a garden hose. If I step on a garden hose, less water is going to flow through that hose. So when spinal stenosis is affecting you, what patients will commonly say is, I can push a grocery cart for 20 or 30 minutes with no problem. But if I try to walk for 5 minutes without support or leaning on something, my legs get weak, they get heavy, they feel like they want to give out. I'll sit down, I'll rest 5 or 10 minutes, and then I'm ready to go again. That is a very common condition related to spinal stenosis, but spinal stenosis itself absolutely can be managed. It can be improved both conservatively, surgically. It's something that just requires an orthopedic evaluation, either with a physician, a surgeon, or a physical therapist. The second condition, one that I see in my clinic every single day, is osteoarthritis. Now, it could be osteoarthritis affecting the hip, affecting the knee, even affecting the foot and the ankle. Osteoarthritis is another degenerative change that happens to the joint surfaces. Basically, what happens is the cartilage, if we're talking about your knee, we're going to talk about the cartilage on the ends of your bones, but also the meniscus. This cartilage starts to degrade. It starts to become bumpy and doesn't have the shock absorption that it had when you were younger. So what happens is you're walking, you're moving, you're doing things throughout your day. And if you suddenly feel a sharp jolt of pain, maybe you might have excessive swelling in the knee joint, the hip joint, the ankle. That is going to contribute to the way the muscles function around those joints. And so commonly with advanced osteoarthritis, the swelling gets worse, the pain gets worse, the inflammation gets worse, and patients will report that they'll be walking across the room and suddenly they'll feel like their legs just want to give out, or they'll feel a sharp jolt of pain and it'll make their knees want to buckle. This also could be something that's treated conservatively with physical therapy, with exercise, with nutrition changes, lifestyle changes, or of course medication or potentially surgery. The final reason why you might feel like your legs want to give out isn't related to the joints or even the back. It's related to the inner ear. So if you've heard of vertigo, sometimes referred to as BPPV, this is a condition that your vestibular system starts to become problematic. You might experience sensation of dizziness, the room might feel like it's spinning, and oftentimes when a patient is experiencing these symptoms, their legs want to give out. So this is a condition that should be treated by somebody who specializes in the treatment of BPPV, or vertigo more generally called. And I would refer you to a physical therapist I know by the name of Amy McMillan. She has a channel dedicated to vertigo. She does an amazing job. Go check it out. I'll link to it in the description of this video. But this is something that absolutely, again, can be addressed with conservative means. There are some really great therapists who specialize in balance disorder, vertigo being one of them. So I hope that gave you some feedback, maybe some ideas that you can talk to your healthcare provider about if you're experiencing episodes where you just feel like your knees buckle or your legs want to give out.